Good morning to everyone. So, in addition to providing an update on the numbers as it stands or to date, there's a bit of additional information that we are going to provide for the benefit of the public in general. So, as of last night, as of 8:30 last night, we have a total of 105 active cases. Only 8 of those are travel related, and the rest, the other 97, are local cases. Yesterday, once again, we recorded a relatively large number of cases. We recorded 30 new cases of COVID-19. We currently have 5 persons in hospital, and up till yesterday, they were in stable condition. Our lab continued to receive, large numbers of samples. From the samples that were processed, 257 were processed yesterday, but that's not all. That wasn't all of the samples that were collected. There is an outstanding 120 samples that we are waiting results for, and those are from those that were collected yesterday only. So 257 we have results for. The remaining 120 we will have those results sometime during the course of the day. So we continue to have a large number of cases recorded. Now, in addition, we note that the places where the cases come from, the number of places have increased. So we now have cases from St. George, St. John, St. Andrew, St. David. All right, and when we receive the results that are pending, it is anticipated that every parish on the mainland, at least, will have cases. So far, we have had no reports from Kerry-Aku and Pitimatnik, but we continue to be vigilant. We continue to test. We continue to monitor. From the patterns that we are observing, it is evident that we have a degree of community spread of COVID-19, albeit at low levels at this point in time, right? But we do have we do have this type or this pattern of transmission at present. We are unable to link many of the cases to any defined cluster or to a traveler. Hence the reason why we have determined that this is where we are at present. Now, we are here at present, and there is a bit of information that the public needs in order to be able to make the best decision, or in order for each individual to make the best decision to protect him or herself and his family. Now, just by way of history, we must remember that persons generally develop symptoms between 2 to 14 days after they are exposed to a positive case of COVID-19. This is referred to as the incubation period. The symptoms that persons may develop may include fever and chills, or fever with shivering, cough, shortness of breath. Now, these were the classic presentations of the disease. What we are noting particularly is that persons are presenting with muscle and body aches, headache, fever, runny nose, congestion, sore throat. Some persons present with upset stomach or nausea, vomiting, and diarrhea. These are common symptoms of this disease that we are seeing in the population. So anyone displaying these symptoms, all right, it is highly likely that you have COVID-19, and you need to take the appropriate steps to ensure that you do not spread this infection to your family and your friends and your workmates alike. There are some signs that we ask persons in the public to look out for. All right, these are warning signs, and they mean that the disease can take a severe turn. Anyone experiencing trouble breathing, persistent pain in the chest, anyone that suddenly becomes confused, all right, or they may become very sleepy, hard to arouse, difficult to awake, or those having pale gray skin or blue lips, all right, or bluish tint on the tips of your nails. These are warning signs. It means that your body is starving for oxygen, and immediate medical attention should be sought. Now that we have the disease here in our communities, we have to look out for the persons who are at increased risk of severe disease, hospitalization, needing intensive care or needing intensive treatment, and possibly succumbing to the infection. All right. Now, there are a series of individuals who are at increased risk for all of these negative outcomes. They include older, unvaccinated adults. If you're in your 50s, 60s, 70s, 80s, all right, as the age increases, the risk for severe outcome also increases. So the older you are, the more you are at risk of severe disease. Persons with certain medical conditions that put them at increased risk of severe disease, hospitalization, and possibly death. These include persons with cancer, persons with chronic kidney disease, persons with chronic lung disease, which includes chronic obstructive lung disease, which occurs especially in persons who are long-time smokers, asthma, and other forms of chronic lung disease. These are at increased risk. Persons with dementia and are unable to care well for themselves. Persons who have diabetes, type 1 or type 2. Persons with heart conditions such as heart failure, high blood pressure, other types of heart disease. Individuals who are infected with HIV, and those whose immune systems are weakened for other reasons. It could be as a result of disease or as a result of the type of medication that they're taking. They're at increased risk. Those with liver disease, those who are overweight and obese. Pregnant women, those with sickle cell and thalassemia, or smokers, especially our chronic smokers. Persons who have had stroke and other cerebrovascular diseases, and those who abuse substances such as alcohol and other drugs. All of these individuals are at increased risk of severe disease. Children may also become infected, and children may also have severe presentations of the disease. And this is especially so in children who have underlying health issues. All right? They are at higher risk, similar to adults. So if the children have any of the conditions above, they are also at increased risk. So those with obesity and diabetes and asthma and sickle cell, they are at increased risk. So in general, the older you are, and if you have underlying health problems or chronic health conditions, you are at risk. So you should take all of the measures you need to prevent yourself from becoming infected. All right. Or pregnant. Just to mention a word on pregnant women. So, if a woman is pregnant or she was recently pregnant, she is also at increased risk for severe disease. But COVID in pregnancy also increases the odds of preterm delivery, that is, giving birth to the child before it reaches the full term, and other poor outcomes, such as loss of a pregnancy. Of course, all of these outcomes, all right, the risk of these outcomes increases if, in addition, a pregnant woman has underlying health problems. She's older than 75. She's older than 25. There is a lot of COVID in the community, and she's unvaccinated. All of these places her at risk for these negative outcomes. Of course, there are important ways in which we can prevent or minimize the impact of this disease. One way is getting vaccinated. All right, vaccination protects the individual from severe disease, from hospitalization and death. Wear a mask to prevent the transmission of the disease. Maintain distance. Avoid crowds, especially in those settings that are poorly ventilated. All right, where persons are very close together, and of course, wash and sanitize. Now, the pandemic is placing some challenges on the health system as we speak. I did mention before that our nurses, particularly in the field, our physicians, they have been at this for many months, and they continue to do so. They have the challenge of keeping the routine health services going, at the same time manning a vaccination campaign and doing testing and contact tracing. So it's a lot. It is a lot. So they need all of the assistance that they can get from the public, and they need the understanding of everyone as well. And if we all cooperate, I think we can get through this together. I'll pause here for now. Thanks.